Today we are going to discuss about the placement of the limb leads on the body of the patient, and along with anatomical locations we will also see what is the relation of these leads with the heart and what is the relation of these leads with the wave of depolarization and why we have positive and negative deflections on different limb leads, why AVR is always negative lead, why 2, 3 AVF they are positive lead, and why sometime AVL is as positive as it is negative. That means isoelectric lead. So today we are going to talk about the placement of the limb leads and its relation with the heart. So let's talk about limb leads of the ECG. Limb leads of ECG. So, giving it a historic perspective, in 1903, a Dutch doctor whose name was Mr. William Einthoven's. Mr. Williams Einthoven's, he actually invented the machine which we call today electrocardiogram or the electrocardiography machine. Initially, it was just a galvanometer, and in 1903, this person did one very important thing. He put 3 leads on the body of a patient. Actually, these were 4 leads. But because one of the leads was used as a ground or earth purpose, so in effect there were 3 leads. Let's see what were these 3 leads. So this is example of a person where he placed his initial 4 leads, and one of these was a ground lead. This is right side of the person. This is right side. This is left side. And these are the feet side. So though he would have placed the lead anywhere from the shoulder up till the forearm or hand, but preferably he placed it on the right arm. The lead he placed on the right arm is red in color. This is on the right side and this is red. The lead he placed on the left forearm is yellow in color, and it was placed on the left side. This was yellow. Now another lead was placed which was green in color. It was placed here on the left foot. Left foot. It is green in color. Green in color. And the last one was black in color, and it was placed on the right foot. This was placed on the right foot. So it was black in color. So let's make this one black. This one black, and this is right foot. This one was particularly used as a ground for ground purposes. And this yellow one, let's make it okay, that's good. So it's yellow one, but because I haven't got a yellow color, so better I make in the red. So initially when the ECG machine was being devised, or it was known as the galvanometer, he placed 4 limb leads on the body, which we still place in the same locations, and they were given certain colors Now we know them by the colors. Read your good book. That helped us devise this mnemonic. The red was placed on the right arm or right forearm. Yellow, it was placed on the left forearm. Green was placed on the left foot, and black was placed on the right foot. Later on, these were given these colors: red, yellow, and green and black, and it helped us create a mnemonic which we call read your good book. Read your good book. Read your good book. So red on the right arm, yellow on the left arm, forearm, arm, whatever you can call, because it can be placed anywhere along it. Green for on the left foot, and B from the book, black on the right foot. And for practical purposes, this is taken off the this picture because it's used as a earth purpose. So let's for a minute take it off here, because it doesn't contribute in taking up the electrical activity. It only is used for the ground purposes. So it has got three effective limb leads: red, yellow, and green. So now the question arises, what was his aim of actually placing these leads on the limb? His sole purpose was to actually record the electrical activity of the heart. Heart is located here in the chest, and there are muscles of the heart which have electrical activity, and he just wanted these electrical activity to be picked up by these leads. So initially he devised three bipolar limb leads, and these were limb lead 1. It had a positive pole. It had a positive pole on the left arm, and it had a negative pole on the right arm. This lead was looking like this. So limb lead 1 was located between the left arm and the right arm. Its positive pole was located on the left arm, and its negative pole was located on the right arm. This is what we call bipolar limb lead 1. Now the second bipolar limb lead, which we call limb lead 2, had a positive pole on the left foot, and a negative pole on the right arm. So it was located like this. It was located like this between limb lead 2, which is another bipolar having two poles, a positive pole on the left foot and a negative pole on the right arm. So it was another bipolar limb lead which was located between the left foot and the right arm. The third limb lead, which once more is a bipolar limb lead, its positive pole was located on the left foot, and negative pole was located on the left arm, and this is located here. It was looking like this, lead 3. So initially he devised three limb leads. These were bipolar. These were looking towards the heart in a frontal plane. So it's lead 1, 2, and 3. These are three initially devised bipolar limb leads having two poles, one positive and one negative. Lead 1 had a positive pole on the left arm and a negative pole on the right arm. Lead 2 was located between the left foot and the right arm, left foot being the positive pole and the right arm being the negative pole. And limb lead 3 was located between the left foot and the left arm, its positive pole being on the left foot and negative pole being on the left arm. So in a way it made a triangle which we now famously know as the Inference Triangle. Let's take this hero out of the picture and let's try to make a simple triangle having a heart in the center of it. Let's make it this way. Okay, if I make a triangle now, this is something like this. It was left arm, right arm, and left foot. Lead 1 is located between the left arm and the right arm. This is lead 1. Its positive pole here and negative pole here. Lead 2 is located between the left foot and the right arm. Its positive pole here and negative pole here. Lead 3 between the left foot and the left arm. Its positive pole here and negative pole in the left arm. So, in order to make the things easy to understand, left foot has got the positive pole of both the lead 2 and the lead 3. Right arm has got the negative pole of both the lead 2 and the 1. And left arm has got the positive pole of the lead 1 and negative pole of the lead 3. So these were the initial 3 bipolar limb leads which Mr. Einthoven actually devised. Heart is located somewhere here in the center. Now this triangle is known as Einthoven's triangle. Einthoven's triangle. Einthoven's triangle. The name of this triangle was given to the great person who in 1903 actually devised this machine which we call the electrocardiogram, and it has revolutionized the medical field, and it has actually taken the cardiology department or this field to the highest level. And historically speaking, it parallel to this historic event in 1903, Wright brothers, they were actually trying to devise aeroplanes, and in the Second World War these were used. So these are historically parallel events which were going on. So in 1903 this person devised a machine. So for his name we know that this triangle is an Einthoven's triangle. Okay, now the aim of these limb leads are actually to pick up the electrical activity of the cardiac muscles from here, and put it on the piece of paper, because the wave of depolarization was going towards all these leads. This one, it goes this way, and this way. The wave of depolarization is moving around all of these bipolar limb leads. So, and we know as a fact that when wave of depolarization is moving towards any lead or electrode, it generates a positive deflection on the ECG paper. So the initial ECG paper, which comprised of only 3 leads, which were the bipolar limb leads 1, 2 and 3, they were positive. Let me draw. Wave of depolarization was moving towards lead 1. So they made a positive lead on the ECG. P for atrial depolarization, QRS complex for ventricular depolarization, and T wave for ventricular repolarization. So lead 1 was a positive lead. What we mean by a positive lead? We mean that there is a positive deflection higher than the negative deflection of S. So this is a positive lead. Why it is a positive lead? Because in this plane the wave of depolarization was going towards the limb lead 1. So same happens with the limb lead 2. Wave of depolarization from these myocardial muscles or cells was moving towards limb lead 2. So the limb lead 2 was also a positive deflection or a positive lead. P positive, first positive deflection for atrial depolarization, a small Q wave, a tall R wave, this is a QRS complex, and then T wave. So again, lead 2 was a positive deflection, and same was true with the lead 3, because wave of depolarization was also going towards lead 3, so it also generated a positive deflection. Lead 3, P, Q, R, S, T. R is taller than in millimeter than the depth of the S wave, so these are all positive deflections, positive limb leads, because wave of depolarization is going towards them. So this is how the ECG paper looked initially when it was devised by Mr. Einthovens, who was a Dutch doctor and who did it in 1903. Now these ECGs, these were picking up the electrical activity of this part, and this part from the frontal plane. But there was a problem, and that problem was that there were some uncovered area in this frontal plane, like the area between lead 1 and lead 2. This area, it was uncovered. No camera or lead was watching this part of the myocardium. Same was true with this part of the myocardium, where lead 2 was looking at this part of the myocardium, because every lead is behaving like a camera which is recording the event simultaneously. If you have got certain cameras fixed around you and you are trying to talk, so every camera will pick up from its own angle, but the event would be the same, but picture can be a little bit different because of the deviation of the angle. So lead 2 was looking at here, lead 3 was looking at here, but this area went uncovered. So same was true with this area, because lead 1 was picking up the electrical activity of this part of the myocardium or the heart, and lead 3 was picking up electrical activity from this part of the heart. So these uncovered area were dealt with later on. If we take examples of different inventions, we know one very particular thing, that when these things are invented, they are very rudimentary, they are very primitive, they are very basic, but at the time goes on, they become fine and fine and fine, and there are some smart options which every machine starts developing. So later on it was devised that though we place the same 4 limb leads, one of them is for the ground purposes. So practically speaking, there are 3 limb leads which we place on the body, but along with 1, 2 and 3, which were initial bipolar limb leads, the scientist actually devised the way to get some information from lead 1 and some information from the lead 3, and they generated another limb lead which covered this part of the myocardium or this part of the heart, and we call this augmented voltage left, augmented voltage left, or AVL. So this is a unipolar, because it sits here and it looks directly at the heart. It doesn't look from the positive to the negative pole. So AVL was devised between the lead 1 and 3, getting some information from both of these leads, and this area was covered. So these are the arbitrary leads the machine has developed. Scientists have developed a feature in the machine. For example, in the mobile phones we have the virtual keypads. We do not carry it with us all the time, but in the beginning we had mobiles which had it physically on the mobile body. So same goes with these kind of machines. Now these have developed into a smart machines. Now 1 and 3, information was gathered, and augmented voltage left was devised, which is a unipolar limb leads, and looking at the heart in this part in the frontal plane. Between a lead 2 and a lead 3, they gathered some information and they devised augmented voltage foot, AVF, augmented voltage foot, AVF. And between lead 2 and lead 1, this area was uncovered, though heart has got a very small strip of the heart on this side, because it is placed in anatomically in such a way in the chest that a very small strip is located posteriorly, but obviously a posterior part of the right side of the heart is an area which was uncovered. So between lead 1 and 2, some information was gathered from both of these leads, and unipolar, another unipolar limb lead was devised, which we call augmented voltage right. Augmented voltage right. So these three are the unipolar limb leads because they are directly looking at the heart rather than looking from one limb to the other limb. While 1, 2 and 3, these are the three initially devised bipolar limb leads. So these are the 6 limb leads. 3 of them are bipolar, 3 of them are unipolar, and these are looking at the heart from all the side in a frontal plane, and they pick up the electrical activity. But if you actually concentrate or focus once more, electrical activity of the heart is going towards all of these sides except AVR. AVR is looking at the heart from the back side. This is exactly as if you are standing on the backstage, and you see everyone going away from you, and the people who are in front of the stage, take analogy of a concert, that they would be looking at the people who are performing, and the performance would be coming towards them, but the person who's standing behind the stage or in the backstage area will be seeing everything going away from that person, and those who are actually standing in front of the stage will be the happier faces. They will be receiving it in a positive sense. The one located on the backside of the heart will be a negative. So the wave of depolarization goes away from the AVR and goes towards AVL, AVF 2, 3, 1. So out of all the limb leads, the only lead which looks the atrial depolarization going away from it, and the ventricular depolarization going away from it, and the ventricular repolarization going away from it, is AVR. So AVR is a totally negative lead. If we make AVR, it would be like this. P is negative, QRS is negative, and T is negative. So AVR is always a negative lead. AVF is purely a positive lead because wave of depolarization is actually going towards the AVF, and AVF makes a positive deflection. AVF makes a positive deflection. So here we come to the lead AVL, because the net flow of the electrical activity is leftward and downward, but the electrical activity does go towards AVL. The AVL is positive, but sometimes it is as positive as it is negative, because majority of wave of depolarization are going this way perpendicular to AVL. So AVL looks it coming towards it and going away from it in equal amount. So it is as positive as negative. So sometimes this is known as isoelectric lead, but in majority of the cases AVL is also a positive lead. P is positive, QRS is positive, and T is positive. This is AVL. So we have got 6 limb leads. 3 of them are unipolar, and lead 1, 2 and 3 they are bipolar, and AVR, AVL and AVF are unipolar. Initially in 1903, when Mr. Einthoven's devised this machine, it had only 3 bipolar limb leads: limb lead 1, limb lead 2 and limb lead 3. Limb lead 1 is located between left arm and the right arm. Its positive pole is located on the left arm and negative pole on the right arm. Lead 2 is located between the left foot and the right arm. Its positive pole is located on the left foot and the negative pole on the right arm. Lead 3 is located between the left foot and the left arm. Its positive pole is located on the left foot and negative pole is located on the left arm. So all in all, left foot is positive for both 2 and 3. Right arm is negative for both lead 1 and AVL is positive for lead 1 and negative for lead not AVL, but left arm is positive for lead 1 and negative for lead 3. But when we look at the augmented voltage leads, AVR, augmented voltage right, AVL augmented voltage left, AVF augmented voltage foot. So these were devised later on. These are the smart machines. Now they have devised the way to gather information and generate these augmented voltage. These are unipolar limb leads. They look directly at the heart. Heart is their positive pole. Otherwise, they are not looking from one pole to the other. So this makes 6 limb leads possible on the ECG paper, and these ECG limb leads, they are looking at the heart in a frontal plane. And we can do one thing. If you look at this picture or diagram or Inference Triangle, you see the lead 2, 3 and AVF, they are looking from downwards upward up. They are looking at the inferior wall. So on the ECG paper, lead 2, 3 and AVF, they will be representing the electrical activity and its associated changes in the inferior wall. And lead 1 and AVL, they are looking at the lateral wall. So these are known as lateral wall limb leads. These are known as inferior wall limb leads, lead 2, 3 and AVF. And as you get along the understanding of the ECG, there will come a time when you will be familiar with the importance of the AVR in actually pointing out ischemic changes on the right side of the heart and the posterior wall. So, but that takes some time. Though in the limb leads, out of the 6, the 1 and AVL, they represent lateral wall, 2, 3 and AVF, they represent inferior wall. AVR, at this point in time, when you are about to understand the basics of ECG, better make a concept that AVR doesn't contribute in knowing the ischemic changes or electrical activity. The most important role of AVR is that if it is not negative, it should always be a negative lead normally. But say if it is not a negative and a positive lead on the ECG paper which you have received from the patient, then there are two possibilities. Either someone has reversed the limb leads. We actually remember the mnemonic, read your good book. On the right arm we place red, on the left we place yellow, on the left foot we place green, and on the right foot we place black. So someone has made an error and placed the yellow electrode on the right arm and red electrode on the left arm. In that case, AVR will become positive. So AVR's importance is very significant when you are to check the position or the malposition of the limb leads. But there is another very important case in which AVR will be positive, that is dextrocardia, because normally the heart is located in the chest on the left side of the chest. But if someone has got left heart located on the right side, that is known as dextrocardia. In that case, this AVR will become positive. Otherwise, AVR should always be a negative lead. So these are the importance of knowing the positivity and negativity of the limb leads. Especially AVR has got this very important task, though it doesn't contribute in any picking of the electrical activity, but with the passage of time you will become familiar that AVR, V1 and V2, when they have got certain changes which you can sense actually, then you get the right sided ECG, and then you pick up the ischemic changes on the right side of the heart and in the posterior wall, which is supplied by the sometime by the right coronary artery and sometime by the left circumflex artery. So if I draw the ECG paper of the limb leads, it will be something like this. Normally 1, 2, 3 AVL and AVF, they should be positive lead. Lead 1 should be a positive lead, P, Q, R, S and T. This is lead 1. Okay. This is how these are actually placed on the ECG paper here in Pakistan. So I'll follow the same pattern. Lead 2 is placed here most of the time, but obviously there can be certain variation. Lead 2 is a positive limb lead, and lead 3 is also a positive limb lead. What I mean by positive? that they have got a tall R wave, and a very small S wave. And it actually means that the wave of depolarization is going towards lead 1, 2 and 3. That is why they are making a positive deflection and a small negative deflection. Lead AVR should be a negative lead. P negative, QRS negative and T negative. AVR is normally always a negative lead, but if it is a positive lead, either it can be because of the dextrocardia or someone has made a mistake and position the limb leads wrongly on the right and the left arms. But now first I'll make AVF. AVF normally is also a positive lead. AVF is also a positive lead, but lead AVL, because of its location, it is positive most of the time, but it can be isoelectric. Positive. Let me first make isoelectric lead. This is P because of atrial depolarization. Q. This is R and this is S. So the height of the R and depth of the S is equal. This is known as isoelectric lead. It means that because of its location perpendicular to the net axis of the heart, which is leftward and downward, the wave of depolarization first goes towards AVL and then goes away from it. So that this camera actually sees 50% movement of the wave of depolarization towards it and 50% going away from it. So R and S mostly they are in equal height and depth. But in majority of our practical cases which we see so often in ICU, AVL is also a positive lead. So don't be bothered by it, but keep one thing in mind: AVR should be negative. Otherwise, 1, 2, 3, it should be positive. We already discussed that 1 and AVL. Out of 6 limb leads, 1 and AVL, they represent lateral wall. 2, 3 and AVF, they represent inferior wall. And AVR at this point in time, at this stage of your learning, it doesn't represent any wall in particular. So lead 1, 2 and 3, these are initially devised bipolar limb leads. Lead AVR, AVL and AVF, these are the augmented voltage right, left and foot. These were devised after a few years to just cover the areas which went uncovered by these 3 bipolar limb leads. These are the unipolar limb leads, and all of these limb leads, they look at the electrical activity of the heart in a frontal plane, so that it should be covered. So lastly, I can just revise: read your good book. Red electrode is placed on the right arm. It can be placed from shoulder to right forearm, anywhere. But why we place it on this area? Because of the decrease in the muscle mass. Because these electrodes are supposed to pick up the electrical activity of the heart starting from here. So the lesser will be the muscle mass, the better will be the perception of these leads. So right is placed here. Yellow electrode is placed on the left forearm, and on the left foot is placed green, and on the black is placed on the right foot we place black lead. Black lead is for the ground purposes, for earth purposes. So effectively we have 3 electrodes which are connected through wires with the machines, and we remember this with the mnemonic: read your good book. Read or red, your yellow, green or good, green, and B from the book. So this helps us to remember the positions of the limb leads. But if we make a mistake and we place yellow here on the right forearm, and left on the left we place red, then AVR will become positive. And the other situation in which AVR becomes positive is when the heart is located on the on the right side of the chest. This is known as dextrocardia, because normally heart is positioned like this in the left side of the chest, and otherwise, AVR has got not much utility except knowing the position of the limb leads. And this is, I hope this will help in understanding of the limb leads. And obviously, ECG is such a document that the more you try to know about it, the better it becomes. But this is a basic idea about the limb leads of in any patient.